Welcome to Central Intake eReferral Training Module for Diabetes Education Referrals Requester Guide. In order to access eReferral, registration is required. Please email mhcentralintake@haltonhealthcare.com to request an account. In today's module, we will review mandatory referral information and how to submit a diabetes education referral. Let's get started. In order to ensure each delivery program receives consistent information for each patient, the Central Intake program, in partnership with the service providers, have put into place standard guidelines for referrals. Please review the guidelines for each service pathway. The Central Intake program will be unable to process referrals missing the required information. Registration is required in order to gain access to eRequest. Please email eReferralsupport@mhcentralintake.com to register. Type in your email address and your password into the fields shown. If this is your first time logging in, you will be required to change your password. Once completed, hit Sign In. The dashboard. This is your main navigation to eReferral. It's divided into sections. New, eRequest. This is where you would start a new referral for one of the pathways included in eReferral. To Do. This section consists of 4 different queues. Awaiting submission. Referrals you have started and saved but not submitted. Requires information. Referrals returned to you for more information. Completed. Referrals indicated as completed by the receiving service provider. Out of region. Referrals that have been routed out of the Mississauga-Halton region. eRequest Summary is a general overview of the total number of referrals you have submitted for each pathway and its current state. Creating a new referral. From the drop-down, select the name of the provider that is making the referral. If you are an administrative staff, ensure you are selecting the name of the physician you are submitting on behalf of. Otherwise, your information would automatically populate. Also, if the requester has multiple practices, you are able to specify which location the referral is coming from. The next step is to pick which service you are submitting the referral for. Then click Create eRequest. The application will open the referral form. First, you must search for the client. This is to ensure that there are no active referrals that may have been created by another user at your organization. Recommended. Search for the client by using their health card number with no version code. If your client is from another province, please ensure you select the province from the drop-down list provided. Then click Search. If you don't have access to the client's health card, or they don't have one, you are able to search by using the client's last name, first name, and date of birth. Type in the search fields the information, then click Search. Refer to your user guide for more information on search matches. If the search returned no results, you'll be required to enter the patient demographics. Any fields indicated with a red star are considered mandatory information, and if not completed, you will be unable to submit the referral. Use your mouse or tab key to move in between the fields. In the phone section, you can add multiple phone numbers by clicking on Add another phone number. Under Tags, you are able to select who that phone number belongs to. Once completed, select Confirm Patient. Diabetes referrals can be made for adult and pediatric patients through eReferral. If at any point in time you would like to save the referral to be completed at a later date, you are able to do so by selecting Save. In order to open the correct referral form, You must first answer the question, is this referral for a person 17 years or under? For adult referrals, please select No. The referral form will display in a separate banner. All fields with a red star are considered mandatory and must be completed prior to submitting. A diabetes diagnosis is mandatory. Please select one from the drop-down list provided. Based on the diagnosis, specific reasons for referral will populate. Please select at least one reason from the list provided. At this time, if you would like your patient to attend a specific program, you are able to identify the program from the drop-down list. If the program is not listed, you can provide that information underneath the additional clinical information section. To initiate a consult to an endocrinologist, provide clarification on whether the patient was seen within the last 12 months. If not, you are able to request an endo by selecting Yes. If you have a preferred endocrinologist, you are able to type in their name in the free text box available to you. If your patient has any complications, you are able to identify them by selecting the checkboxes associated with each complication. If a complication isn't listed, select Other and type it in. A1C lab result is the only lab result that is currently mandatory in order to submit the referral. Please type in the lab result and the lab result date in the fields shown before you. Diabetes medications can be added by selecting Yes and Add Medication. You are able to utilize one of two options. Search for the medication through our predetermined drop-down list, or manually add each medication in the free text field. Once completed, select Save. At this time, you are able to provide any additional clinical information you would like the service provider to have. You will have an option to add supporting documentation after the referral has been submitted. Please see video tutorial attaching supporting documentation for step-by-step instructions. Once completed, select Save and Submit. You will receive a pop-up asking you if this is the action you would like to complete. Select OK. Once the referral has been submitted, the record will be created and the status of the referral will be displayed in the top right-hand corner. At this time, you are able to review, update, and attach additional supporting documents to the referral. For step-by-step instructions on attaching documents, download the Requester User Guide or watch a short video tutorial available to you in the resource section. Please ensure that blood work, including HbA1c, has been completed within the last 12 months. This is required by the Diabetes Education Program. For additional support, contact eReferral support at haltonhealthcare.com or phone 905-338-2983 extension 4870. You may also visit www.mhcentralintake.com for more resources and user guides.